What is leukemia? Leukemia is a neoplasm. What kind of neoplasm? Benign or malignant? It's a malignant neoplasm. And as there can be no vegetarian tiger or no oven hot ice cream, because that's not possible, fundamentally not possible. Similarly, there is no benign leukemia. Leukemia, by definition, by default, is always malignant. From where this malignancy arises? Answer is bone marrow. Now we colloquially call it blood cancer, but actually this is not arising from the peripheral blood. Rather, they're arising from the bone marrow. What are the source of origin of this cancer? Means from which cells they arise? Answer is hematopoietic precursors. So this is basically a malignant neoplastic process, leukemia, which is arising from the hematopoietic precursor cells in the bone marrow. Nowadays, it has been proven that cancer or malignancy is basically caused by a series of genetic changes in a cell, and those kind of changes occur in hematopoietic precursor cells. When I think about cancer, the one movie which comes in my mind frequently, that is Joker. I think in the Joker movie, recent blockbuster Joker movie, I've seen that story that basically tells a story about a person who was leading a normal life, and how by a series of assaults or hits in his life makes him malignant. That means turns him into a villain from a normal person. So the story of cancer development is also something like this. That means he was leaving a cell in the bone marrow. They were living like a normal cell, and it got hit by a series of changes, a series of mutations, and that leads to the development of malignant proliferation of the cell. They starts to proliferating crazily. So this is the idea, this is the concept of the cancer nowadays. So that implies also, that also holds true for leukemia. Now, leukemia, if you break the term, it basically could be divided into two words, leukos and emia. Leuco means white, like leukorrhea, white is discharge. Leukoplakia, white kind of plaque. Leukocyte, white blood cell. So leuco means white, and leukemia, emia means in the blood, like ketonemia, excessive ketone in the blood. So the term basically literally means that excessive amount of white blood cell in the peripheral blood. But that also not completely true, because this is not only the cancer of the white blood cell, this is basically cancer involving all blood cell lines, because both myeloid and the lymphoid. So, because for example, AML M6, it is basically kind of erythroleukemia involving RBC. So, leukemia does not always involve WBC, it could also involve RBC and platelet. This you should keep in mind. Now, come back to the initial point which I was talking, that leukemia is nothing but a neoplastic process. It's a malignant neoplastic process involving hematopoietic precursor cells and arising in the bone marrow. That is the basic idea of the leukemia. Now, leukemia comes in two flavors, acute leukemia and chronic leukemia. That is the basic classification. Now, acute leukemia, because this InstaLecture number 1 or 2 is basically about the acute leukemia's key problems, key ideas in the pathogenesis. Acute leukemia is, for example, acute myeloid leukemia is characterized by more than or equal to 20% blast cells in the bone marrow or peripheral blood. I think you have read this. But what is the idea behind this? Why there is excessive number of blast cells are seen in the acute leukemia? The concept is this, that there are two series or two kind of mutations occur in the hematopoietic precursor cells for the development of acute leukemia. One series of mutation give them the proliferative advantage. That means those cells, hematopoietic precursors, they start to proliferate crazily from 1 to 10 to 10 to 1000 and this way. And that's they crowd out the normal cells in the bone marrow. And second kind of mutation which occurs in the acute leukemia, that basically blocks their maturation. Those primitive precursors, they cannot mature into the further mature cells down in the line. For example, if you look at a neutrophil's life cycle, from the myeloblast, there is promyelocyte, there is myelocyte, there is metamyelocyte, there is band form, and then there is mature neutrophil. So in this case, when these myeloblasts in the acute leukemia, they are proliferating, or they are basically becoming malignant, these myeloblasts, they cannot turn into further mature cells down in the line. There is a blockage in their maturation. That means those myeloblasts, they cannot turn into myelocyte, metamyelocyte band from the mature neutrophil. This is getting blocked. And that's why the number of myeloblasts, they are increasing in the bone marrow. And that's why in acute leukemia, the characteristic feature is very high percentage of the blast cells in the bone marrow, more than or equal to 20%. Depending on if that is myeloblast, we call it acute myeloid leukemia. If that is lymphoblast, we call it acute lymphoblastic leukemia. And that could be divided, this classification, by identifying the type of blast morphologically, by flow cytometry, immunophenotyping, cytochemistry. You can do that. The next big concept is this, that what is the usual presentation of acute leukemia? They have a similar pattern, because what's actually happening in acute leukemia? Acute leukemia, a blast cell, hematopoietic precursor cells which has become malignant, they are crazily proliferating and they are staying in the blast cell rather than converting into a mature cell. You can think it like it's a condition, it's a story of a city where there is an increased number of babies are getting delivered, but the babies are remaining as babies. They cannot mature into school-going kid or toddler or into adults and or into the adults. So obviously very soon what would happen in the city, there will be a lot of babies would be newborns. There will be increase in number because those newborns are staying in the newborn stage and they are also proliferating many newborns. Many newborns are getting born, but they are not maturing. So very soon the whole city would be, their population will be made with those newborns. Similar story is happening here. The bone marrow, there is a proliferation of these hematopoietic precursor cells are occurring. And these hematopoietic precursor cells, actually the myeloblasts, they are staying as myeloblasts. They cannot mature into myelocyte, metamyelocyte band from the mature neutrophil. So very soon, the whole population of the bone marrow, they get replaced by or crowded out by this increased number of the blast cells. And depending on the type of the blast cell, if it is myeloblast, we call that condition acute myeloblastic leukemia. If there is a proliferation of the lymphoblast, we call that acute lymphoblastic leukemia. And usually they're present with a feature of bone marrow failure, because the presentation would be with features of anemia, like there could be breathlessness, pallor, there could be recurrent infection, and then there could be some episodes of the bleeding, like gum bleeding. And why it occurs? The idea is very simple, because as all these blast cells, they're rapidly crowding out the normal population of the cells in the bone marrow. The normal population of cells are dying there. So obviously there is no RBC precursor cells in the bone marrow. What would be the net outcome? There would be anemia development because mature RBCs are not coming into the peripheral blood. If there is no mature neutrophils, they are coming out in the peripheral blood. What would be the net outcome? There would be neutropenia, and the resultant effect would be recurrent infection. If there is no mature platelets are coming to the peripheral blood because their precursors, the megakaryocytes, are getting replaced by these blast cells, what would happen? You would be having episodes of bleeding, like gum bleeding. So these features, which usually present in acute leukemia, both acute leukemia, AML and ALL, the features are usually due to bone marrow failure. And in some other conditions, you can get other features, specific features, like monocytic variant of acute myeloid leukemia. You can see gum infiltration, because they actually, monocytes like to go to the tissues. In ALL, you can get CNS involvement. So this kind of characteristic features you can see in the type of the leukemia. ALL, you can also see testicular involvement. But the key feature of all of them, this acute leukemia, is that there would be a acute stormy, very rapid onset of presentation with pallor, rapidly developing recurrent infection, and the bleeding episode, which is developing very rapidly because the bone marrow is getting replaced by all this crazily proliferating precursor cells, blast cells, which are not getting matured further. So that's the basic idea of the acute leukemia. So you can say in this way that acute leukemia is a acutely, rapidly developing leukemic process, which is basically, leukemia is a malignant neoplastic process involving the hematopoietic precursor cells in the bone marrow. And acute leukemia is characterized by two characteristic features. That is, one, the blast cells, the precursor cells, they get the capacity to proliferate crazily. And secondly, they also lose the capacity to mature further down the line in the series. That means the blast usually remain in the blast. They cannot mature into the mature cells in that cell series. Obviously, they have a common feature in the presentation. They present with features of acutely developing bone marrow failure because as these blast cells crowd out the bone marrow population. So these are the key things that you need to keep in mind while thinking about the acute leukemia. Thank you very much for attending this session.